Okay, good morning, everyone. Hoping that you can hear me okay and see me okay. Welcome to today's webinar on urinary incontinence. It's nice to see you all. I hope you had a nice break. For those of you that were able to take a break from work, we're going to be doing urinary continence today. So we're going to be looking at what that means and how we can support our service users with urinary incontinence. So my name's Lucy Caldwell. I'm the RGN at QCS. And I sort of look after the care management side of things. I've met a few of you before, I recognise some names. Some of you are new to this, so welcome. It's nice to see you all. Just to let you know that the email that you registered with is the email that you will get a link to. That'll be next week, and that'll be linked to your CPD certificate. And that will also be a link to get this recording. So it's being recorded, just so that you're all aware. So you'll get your CPD certificate, you'll get a link to the recording, and you'll get a resource pack as well. So basically, it's everything that I'm sort of talking about today. You'll get that in a resource pack that you can refer to as well. So it's 11 o'clock now, so we'll get going. I'm just going to switch my video off for this. I've muted everybody, but do feel free to unmute yourself if you have a question. It might be better actually, rather than unmuting yourself, just to pop that in the chat if you've got a question. But we will have a Q&A at the end as well. I always sort of leave about 10 minutes or 15 minutes at the end just to do a Q&A. Good morning, Glenn. Nice to see you. Welcome. Okay, so let's get going. Sorry, I've got a frog in my throat there. Okay, so urinary incontinence, supporting service users with urinary incontinence. So over the next sort of half hour, 45 minutes or so, we're just going to be looking at urinary incontinence, and we're going to be covering the following. So if I just go on to my next slide, we're going to be looking at what is urinary incontinence. We're going to look at when to seek medical advice for it. Causes of urinary incontinence, treating it, preventing it, and also we're going to go onto the system and we're just going to look at support for those with incontinence issues, urinary incontinence issues. We're going to have a look on the care management system, and I'm just going to show you where our continence care plan sits. Just a couple of other documents as well that you might want to use when you're sort of looking at someone's continence. Just to make you aware as well, currently we don't have an incontinence assessment on the system, but that is coming soon. Hopefully within the next couple of months. That's all sort of getting tested at the moment on the demo site, but that is going to be available very soon. So a continence assessment for both urine and feces, actually, is going to be for both of them. So that will be coming soon as well. So it's not on the system at the moment, but that is coming up. Okay, so I've sourced the information from the NHS and other sources. If you click this, obviously you'll get the link when you get these slides, so you can always visit this web page as well if you wanted to sort of, go over sort of any more information about incontinence, then feel free to do so. Lots of resources out there. Okay, so let's look at what is urinary incontinence. So urinary incontinence is the unintentional passing of urine. So it's a common problem thought to affect millions of people, and it's the unintentional passing of urine is the definition of urinary incontinence. So there's different types. I'll just go through those now. There's several types of urinary incontinence. The first one's stress incontinence. So that means when urine leaks out at times when someone's bladder might be under pressure. So, for example, when somebody coughs or laughs or sneezes, and then maybe leaks a small amount of urine. Not empties their bladder completely, but leaks a small amount of urine. So that's when when the bladder's under pressure. That's what we would call stress incontinence. There's also urge incontinence or urgency incontinence. So that's when urine leaks out when you feel a sort of sudden intense urge to go for a wee, or very soon afterwards. It's that sort of urgency feeling and leaking then. And then overflow incontinence, also known as chronic urinary retention, is when you're unable. Oh, let's just have a look. So overflow incontinence or chronic urinary retention is when you're unable to fully empty your bladder. So if you can't fully empty it properly, it causes frequent leaking. So it's just the sort of inability to empty one's bladder. Total incontinence is when your bladder cannot store any urine at all. So it can't store any urine, and that makes you pass urine constantly or have frequent leaking of urine. Um, and you can have both types. You can have both stress and urge urinary incontinence. So you can have a mixture of both stress and urge urinary incontinence as well. So let's look now at the next slide, which is when to seek medical advice. So any type of urinary incontinence should be checked over by a GP. Might be something that someone's been experiencing for a while, might be a recent issue. However long it's been, whatever the reason, you must, support that service user to go and see the GP just to chat about what might be causing that and to see what treatment options are available. It is a common problem. Often people are quite embarrassed to talk about incontinence and leakage and leaking urine or sort of, not being able to control whether when they empty their bladder, it can be embarrassing for people, but it's important to just reassure that person in your service that you'll support them to sort of get some help and some advice and some information about that. And just encourage them really to talk about their symptoms and not feel embarrassed or try not to feel embarrassed because seeing the GP is like the first step really towards finding an effective way to manage the problem that someone might be facing. So urinary incontinence can usually be diagnosed after a GP consultation. So the GP will ask you about your symptoms. The sorts of things that a GP might do is a pelvic examination or a rectal examination. So looking at your, the muscles around that sort of area. So, different examinations depending on whether you're male or female. They may also suggest keeping a diary. So that's what we would know as a bladder diary. And that's where they would ask you perhaps, or ask you to, or ask the service user to note how much fluid is being drunk and how often you have to urinate. Perhaps, when you've leaked or when you've been able to get to the toilet, or, just keeping a diary of those things so that the GP or a continence nurse might ask for this as well. Could just have a look at that diary over a period of sort of 3 or so days and just see what's been happening there continence wise. And they might refer you to a specialist for more tests as well. So that's when to seek medical advice as soon as any type of urinary incontinence is experienced. And let's look at causes. What causes urinary incontinence? So it's caused by weakening or damage of the muscles that prevent urination. So you've got muscles that can control when you have a wee, when someone has a wee. And if those muscles are weakened or damaged, then that's when you might sort of experience stress incontinence. So, for example, the pelvic floor muscles, and you also have the sphincter, a urethral sphincter. So they're both muscles, and they might be checked out by the doctor when you go and visit. Someone's just popped a question on there, so I'm just going to have a quick look. Oh, Nicola, that's okay. Don't worry. It's nice to see you. I'm glad you're here. Nice to see you. So weakening or damage of the muscles that prevent urination, that might cause urinary incontinence. Overactivity of what we call the detrusor muscles, so that might cause urge incontinence. The detrusor muscles control the bladder. So it's all kind of generally comes from muscle related for those first two. The third point there is bladder obstruction or blockage, which is what we've termed before overflow incontinence. So that's something that's causing a blockage, which needs investigation. Something that's causing a blockage, which prevents the bladder from emptying fully. That's what we would call overflow incontinence. The cause could also be something from birth, which might cause total incontinence. So something might have been experienced from birth, which has caused a problem with the bladder, such as a spinal injury, for example, or a fistula. And a fistula is like a small sort of tunnel-like hole, and that can form between the bladder and a nearby area. Sort of like a little tunnel, that's called a fistula. So there's a few different causes. And then certain things can increase the chances of urinary incontinence. and they include things like pregnancy and vaginal birth. So that's what the doctor would take a note of if you're sort of seeing them about urinary incontinence, obesity, a family history of incontinence, and increasing age. I mean, that doesn't mean that incontinence is an inevitable part of aging. It is an issue that needs to be looked at. So it's not just an inevitable part of aging. That is one of the things that could increase the chance of urinary incontinence. Let's just have a quick look at the question. Yeah, absolutely, John. John's just asking here, could another cause be prostate cancer for men? Yes. And also an enlarged prostate. So not necessarily prostate cancer, but an enlarged prostate. And that can cause issues with going to the loo intermittently for a wee as well. So yeah, absolutely. Prostate issues. And also prostatectomy, so removal of the prostate. That can also cause incontinence issues as well. So there are many different causes for incontinence in both men and women. So if we just look now at treating urinary incontinence, let's go to this page now. So there are non-surgical treatments and surgical treatments. So if we just look first at the non-surgical treatments. So initially a GP might suggest some simple measures just to see if they can help or improve your symptoms. So before going on to sort of surgery or what have you, they might look at what they can do to sort of try and help in the immediacy sort of thing. So making lifestyle changes. So that could be things like losing weight or cutting down on caffeine or alcohol, things that make you sort of cause a sort of diuretic effect that make you want to go for a wee. They might recommend pelvic floor exercises. So that's exercises where you strengthen your pelvic floor muscles, so by sort of squeezing them. They might recommend bladder training. So that's learning ways to sort of wait longer between needing to urinate and passing urine. And then use of incontinence products, of course. So they might be beneficial, such as absorbent pads and handheld urinals. And then, of course, medication. There might be certain medications that might be recommended if symptoms aren't able to be managed. And also, just in terms of using incontinence products, it's very important to, that we're trying to sort of like promote continence in people. So help people remain continent. So in terms of incontinence products, yes, of course, they need to be used. But it's just about using those appropriately and not as a sort of preventative measure sort of thing. The idea is really that we need to be trying to promote continence as much as possible and really support them with getting to the loo in time and things. But yes, of course, incontinence products will be used. So then if we look at surgical treatments, so surgical treatments that might also be considered surgery. There's different procedures depending on what type of incontinence you've got, would depend on what is suitable for that person. So the surgical treatments for stress incontinence, and there's such a thing as a sling procedure, and that's used to reduce pressure on the bladder. It's also used to strengthen muscles that control urination as well. And then also there is surgery to treat urge incontinence. So that includes things like surgery to sort of enlarge the bladder, or also implanting a device that kind of stimulates the nerve that controls the detrusor muscles, therefore helping you to control when you urinate. There's non-surgical and surgical treatments. Obviously, they'll try the non-surgical first, is the likelihood, and then perhaps go on to surgical if that's not working. So let's look at preventing urinary incontinence. So there's certain steps that may help reduce urinary incontinence. As I said before, it's about promoting continence. So it's not always possible to prevent urinary incontinence, but there are things that you can do to help reduce the chance of it happening. So it's important that we look at those and we put those in the care plan when we're looking at sort of the support we can offer as well. And I'm going to go on to look at support that we can offer and what you could put in the care plans, suggested support. So steps that might help reduce urinary incontinence, maintaining a healthy weight. So being obese can increase your risk of urinary incontinence. So if you can support someone to lower their risk by maintaining a healthy weight through regular exercise and healthy eating, then that could be a positive thing. Also changing drinking habits, so cutting down on alcohol and caffeinated drinks, things that contain caffeine, because drinks that contain caffeine, tea, coffee, cola, etc., they can cause your kidneys to produce more urine and therefore irritate your bladder. So that would be why you're being asked to change drinking habits and cut down on those caffeinated drinks and alcohol. So I've just got a little note here. Actually, the recommended weekly limit for alcohol consumption is 14 units. A unit of alcohol is roughly half a pint of normal strength lager, or a single measure 25 minutes spirits. I'll just put that there as a little note. The GP could also give you advice on fluid amounts as well. So that depends on what sort of bladder problem you've got, but the GP can advise about the amount of fluids that you should drink. I think you should restrict that, or drink a sort of certain amount of millilitres a day, for example. And when we go onto the system, I'll show you the fluid chart that's got a target on there that you can put in place. So, for example, it might be if you urinate frequently during the night, that's something called nocturia, so like frequent urination during the night. It might be an idea to try drinking less in the hours before you go to bed. So not drinking less throughout the day, but just drinking the required amounts, your daily amounts earlier. So perhaps drinking less in the hours before you go to bed, but it is really about maintaining the correct fluid amount during the day. So just perhaps drinking less before bed, but still making sure that you're drinking your full amount of fluids that the recommended sort of daily intake, which is about sort of 1.5 to 2 litres. So also pelvic floor muscle exercises. So we mentioned before about being pregnant or giving birth, that can weaken muscles that control the flow of urine from your bladder. So if someone is pregnant or a service user is pregnant, then strengthening pelvic floor muscles might help prevent urinary incontinence as well. So everyone could benefit from strengthening their pelvic floor muscles with pelvic floor exercises, but particularly if someone has been pregnant or is pregnant, sort of prone to that. So I've just put here, of course you're going to get these slides, but I've just put here the link for the NHS website on urinary incontinence. So that's just there if you wanted to sort of have a look at more information. So before we go on to the system, I want to just go through support that you might want to think about when you're care planning for someone with incontinence. So the support points that we're going to talk about are suggestions only. It's not a one size fits all. It never is. We need to do individual care plans, but there's kind of suggested support that you might want to think about and then adapt for that person in an individualized way. We've also, the support points that we're going to go through now as well, they can be found in the preset text, that editable template text within the continence care plan. So I'll show you that just so that you've got an idea of where that is. So for customers, I'm sure you're probably aware of that, but I'll just remind you where it is, just so that you're aware of how to pull this support through to your continence care plan. So I will just let you know where that is when we go onto the system. So again, it's suggestions only, but the care plan should be individualised and centred around the person that you're supporting, focusing on their needs and preferences. Okay, so let's go on to that support. And as I say, this is all in that preset text, so it is there available to you. For non-customers, you'll be getting this resource pack as well, so you're going to get all this support suggestions in there. It's not an exhaustive list, but it's kind of common sense support recommendations. So first of all, as we were talking before, when we're thinking about support, we're thinking about trying to prevent incontinence. So we're prompting that person or supporting them to use the bathroom. That's the key thing. And checking clothes and underwear that, are not soiled and what have you. But it's about really trying to support that person to use the toilet frequently if they're experiencing urinary incontinence. Of course, the key point is maintaining privacy and dignity. Privacy and dignity. Ensuring that's maintained at all times. Ensuring doors or curtains are closed when any personal care is being given to that person. Ensuring that you communicate with them in a respectful and discreet manner. There's nothing worse than sort of hearing people, sort of loudly expressing that they're going to take someone to the toilet or something. It's something that needs to be done in a sort of quiet and dignified way. And And also it's important to ascertain with that service user who you're supporting, if you're supporting them with personal care and things, or taking them to the loo, whether they want a male or female carer. It's really important that that question is asked and where possible, honoured. So any interventions need to be explained. So staff need to explain any interventions that are taking place so that they're fully informed about what is happening. That person's fully informed about any support that you're offering and why that support's being offered, for example. So for someone with dementia that might be sort of forgetful or a cognitive impairment of some kind, it's important to understand how best to communicate with that person and record that in your support plan. The best way to explain what's happening and just to always make sure that you are explaining what's happening with that person. Call bells and alerting aids, of course, ensuring that the call bell's near or other alerting aids within reach. So if someone suddenly needs to go for a wee, they can quickly press that call bell if they need support to get to the loo. And then clear signposted environment is really important too, and this can all be put in your support plan, just ensuring that people have got easy access to the toilet. So, and also when we talk about environment, again, people perhaps with dementia or something, sometimes there's issues with eyesight, so it's really important that you think about the environment, that you think about that it's sort of clutter-free, there's nice, clear, large signs that show you where the toilet is. When you then use the loo, it's important, the decor of the loo, if it's all sort of white and beige and pale, it's difficult to sometimes see the toilet. So accidents can happen there. So it's nice to have kind of contrasting colours. So a white wall and then a black toilet seat, for example, it's very clear then to see where the toilet is. So it's just really about helping that person to understand their environment and ensuring easy access to the facilities. Checks need to be done frequently if someone is using incontinence pads and they're unaware that they're being incontinent. Some people are unaware that they're being incontinent of urine. So it's just important to check those often. Some people might use different types of incontinence pads, so it's just important to record in the support section what type of incontinence pads they use. You can always get advice on that as well from continence nurses, for example. It's a good idea to record output on the fluid chart. Also intake to check that someone's drinking enough, because often people, when they're incontinent of urine, they do reduce their fluids because they don't want to be incontinent. It kind of makes sense, doesn't it? But it's obviously could make them prone to dehydration. So it's important to check that they are drinking enough. So you can put a fluid chart in place if you feel that's appropriate, if that service user feels that's appropriate. So any episodes of incontinence should be recorded as well. So again, if you do a sort of bladder diary for that person, or you're just making a note over a few days of when they were incontinent, then that should be recorded, especially if it's being assessed by, let's say, continence nurse, for example. Personal care, you can put in the support plan how you would offer that personal care, what sort of thing that person wants, what support they need. Ensuring that personal care is given in a timely manner as well, and no one's sitting there, having been incontinent and sitting in urine, those are more undignified really. So it's ensuring that personal care is given in a timely manner and that skin checks are done as well and creams applied as appropriate. So to avoid any kind of irritation to the skin, it's important to keep checks on the skin. Also to be aware of UTIs, and you can put this in the support plan as well. So if someone is becoming increasingly incontinent of urine, maybe more than normal, just to be aware of urinary tract infections. So you might want to check for blood or an odour or cloudiness or sort of dark yellow or orangey colour of the urine, just to be aware that there could be a UTI for that person and just send off specimens as appropriate if you feel there is. Of course, monitoring for any signs of confusion that isn't normal. It could be a sign of a UTI as well. So if someone is experiencing a sort of the urge to urinate, that that's obviously going to give them a, a high risk of incontinence as well. So practice universal precautions. So when I say universal precautions, that's infection control procedures, and that's treating all blood and body fluids as if they were known to be infectious. So it's really important that, to stop the risk of any infections, that universal precautions are met, that both staff and the service users that you're supporting are practicing excellent hand hygiene, that any personal protective equipment or PPE is used when supporting that person with sort of bodily fluids, and also that laundry and waste is managed in an appropriate way, and that any waste is disposed of safely. So again, we can put all this kind of thing in the support plan as well, because it all goes towards supporting that person in a holistic way. So if we look at psychological support, so it's important to offer sort of reassurance to that person and make sure that person's sort of kept fully informed about what's happening. Can be quite soul destroying, I would imagine, if you're incontinent of urine, and it's something that you're experiencing, and whether you're sort of fully aware of that or not, it's just something that anyone who's experiencing that would need reassurance about. It's about making appropriate referrals. That could be to the GP, it might be to the incontinence nurse who can give you information and advice on sort of treatment plans. And it's about listening to those treatment plans and recording those treatment plans that might have been given to you by the incontinence nurse or GP, for example, and making sure those treatment plans are followed and incorporated in your care plan. So that's just an idea of some of the types of support that you can give. Obviously, you individualise it, but I'm just going to go onto the system now. Before I do that, I'm going to have a quick look and see if there's any chats, any questions, which there's not. Okay, so let's pop onto the site now, and I'm going to just show you over the next 10 minutes or so what we've got on the system that can help you record the support that you're giving to someone who's experiencing urinary incontinence. So let's just go onto the system now. Okay, so we will go into Sally. I'm going to show you. So as customers will already know, everyone's got 20 care plans when they get put onto the system, and one of those care plans is a continence care plan. So that's in there as standard. And as I say, in the next couple of months, we're going to get a urinary incontinence assessment put in there as well. So in the assessment section, so you can be able to link that into a continence care plan. So this is what it looks like. So if I just pop into this, obviously you've got the support on the slides and in the resource pack, so you'll have that support sort of sent over to you. But just to show you what our care plans look like, this is where you would have your assessment in there. Once that comes in there, the incontinence assessment, if you needed one, that person. This is where you've got your sort of review section, and then this is the care plan. So the care plan is looking at what the sort of issues are with continence or incontinence, what the goals are. So again, this needs to be discussed with that person, how you're going to promote continence, and then what support you're going to put in. So we've got loads of support here. Some of this support is what we've just been talking about now. I've also personalised it for Sally. I've popped a bowel chart, a fluid chart in place as well for her. Just want to sort of make a note of when she's going to the loo when she was incontinent. So that's what the care plan looks like. I'm going to show you now. We can't. This has been published, so this is like a sort of locked-in care plan. But what I'll do, I'll just go into somebody else and I'll show you that preset text. Let's go into Sally Smith. I just want to show you. Let's pop her continence care plan back in. There we go. Okay, so I just wanted to show you that preset text. So if you go into the continence care plan, everyone's got it on the system, unless you've gone in and adapted it yourself or changed it. And everyone will have this preset text or access to it. So if we go into the care plan, we've got our little notepad here. So we've got what are the sort of needs, what are the issues, what are the goals, and how we're going to support them. So we have text for incontinence. We've got text for if someone's got a catheter. We've got text if someone's got a UTI. We've got text if someone's got constipation or a stoma. So there's quite a few different areas of text. But if we just concentrate on this top text, let's use this. So it just pulls a statement through. There you go. She's incontinent of urine or feces. So you just adapt it appropriately, change the colour all to black text. Do the same for goals. Chat about her goals. Sally might have different goals. That's fine. We can change those. But it's just this sort of suggested text that you might want to use. And then all that support text that we've just talked about then, click that, that pulls it through. Okay, you've got all that support text there. So we'd go through it and we'd just make sure this is appropriate for Sally. So check Sally's incontinence pads every, of course, it's not the same for everyone. So we've put red text in here. You would then adapt accordingly. Might be things that you don't need. There might be more detail that you need to put in that's appropriate for Sally. You really need to personalise that, but it's just giving you that suggested text. So that's your preset text. And that's where your continence care plan sits. On that main care plan page, there's one dedicated to continence where we can very much look at promoting continence for that person. What I've also put in actually for Sally is, let me just go into our, let's have a look. So I've created Sally, just go into our sort of daily actions page. I've put a bladder diary in there for her. So what I've done is I've just added a fluid chart. If I just click on that, I've added this bladder diary. Let's say, for example, the incontinence nurse has said, could you keep a bladder diary for her for the next 3 days? So what I've done, let's have a quick look at it. I've created this action and I have just put some instructions in here, some care, the support that's needed. So she's on a bladder diary to record any episodes of urinary incontinence along with fluid intake and output. And then I've just put in here, please record in the notes any leaks or accidents and what Sal was doing at the time, e.g. physical activity, sitting in a chair, coughing, etc. The bladder diary is to be completed in a timely manner over 3 days at the request of the continence nurse. Please support Sal with personal care, check for skin irritation and help maintain excellent hygiene. Always ensure Sal's privacy and dignity is maintained. So I've just set up this text just to guide the carers or the support workers on what they need to be recording in here. So they can put that, it might be that they're on pads and then you can't obviously necessarily measure that. So you don't need to necessarily put a fluid chart in. It might just be that you want to just put just a simple action in with the notes. Put a checklist in if you want. But if you are able to measure, you can put your note in there. So let's say and her output was 100 mils, leaked to small amounts, supported Sal to go to the toilet, for example. Okay, so I'm going to put lots of detail in there. Maybe she was doing an activity. Maybe she just had the urge to go and she was able to make it to the loo, but you need to just record, just exactly what's been happening so it's very clear for anyone to see. Just out of interest as well, if you also had a fluid chart in place, it does speak to the same chart. So don't worry. I mean, I've just put this as a bladder diary. I could just leave the fluid chart in place and use the fluid chart to make a record of, whether she's leaked, whether she's been incontinent, whether she's made it to the loo. I could just do that on the fluid chart in the notes. But I've just put a bladder diary in just to make it a nice visual for the staff, just to remind them that she is on a bladder diary. But if I have got her on both, got a service user on both, a fluid chart and a bladder diary, it talks to the same chart. So if you did one, fill this in and not that one, it's going to go to the same chart. So just to make you aware of that. And just to remind you all how to set up an action, how to set up what I've done. We go into the action section. So I'll click that plus button to pull up this prompt. Okay, and it looked like this. There we go. So I've called it a bladder diary, linked it into my continence care plan. I've added an observation chart, which is a fluid chart. If you can't always measure the urine, then you perhaps wouldn't want to add a fluid chart because you're not going to be able to measure the output necessarily. And it might be that you just want to put some details in here about describing the pad and the sort of flow of urine. You can put whatever instructions you like in here and then save that. And that's how I've popped that in place. Okay. So I'm hoping that makes sense to everyone and sounds okay. As I say, we've also got the continence assessment that will be available in the next couple of months. But that is all for today. I'm just going to show you the report as well, actually, because if you go into this detailed section here on the service user page, management page, go into the daily actions. Let's just select a bladder diary. There you go. I can do that, generate a report, and that will pull up every time she's been to the loo. And, you know, the comments, there you go. So she had a small leakage yesterday, doing armchair exercise. At the time of the leakage, she informed us and we assisted her to the toilet. I supported her with personal care. So it's just about writing what the scenario was, along with any fluid intake, or output rather, and intake as well. But you've got a little report there and you can print that off or you can save it to a PDF. Well, I hope that's helped everybody. If there's anyone's got any questions, feel free to put it in the chat. If you wanted to message me privately, that's absolutely fine. My email is lucy@carebeans.co.uk. Lucy, lucy@carebeans.co.uk. Feel free to drop me a message and I'm happy to take you through it. I can give you a demo of the site if you wanted to for any non-customers. If you're interested, just drop me a line at lucy@carebeans.co.uk. I'm just looking at messages now, Nicola. I'm glad you found it informative, Nicola. That's great. Thank you for telling me that. That's really nice to hear. I shall hang around for a bit and see if there's any more questions. We have got this same webinar repeated on Thursday, this Thursday coming at 1 o'clock. So if you've got any colleagues that might want to register, just go onto our website, www.carebeans.co.uk, and get them to register for that. And as I say, next week, it will be next week because we wait till the 2 webinars are finished. Next week, you will get a link to the email that you registered with for your CPD certificate, your resource pack, and the slides as well. Okay, so it doesn't look like there's any questions. So as I said, if you want to drop me a line, lucy@carebeans.co.uk, do feel free. If there's anything you think of afterwards that you wanted to ask, just drop me a line and I shall get back to you as soon as. And if there's no further questions, then I shall let you all get on with your day. Thanks a lot for joining. And see you next month. I think next month, so we'll check on the website. Just keep your eye on the website just to see what next month is. But I think it's infection control and prevention that I'm going to do next at the end of May. So just keep your eye on the website for that and you can register. Okay, so I'll stop sharing and I will let you all go. Thanks for joining and I'll see you very soon.
Thank
Thanks
you.
a lot. See you soon.
Thank
Bye-bye.
you so much. This was really
Thank
good.
you,
Thank
Lucy.
you.
Good.
Thank you,
Thank
darling.
you.
Thank you.
Okay, bye-bye.
Bye bye.